Now we have a very interesting comparison between two very interesting drugs, which is Telmisartan and Clonidine. Now these are totally two different group of drugs. Telmisartan comes from angiotensin receptor blocker. Now angiotensin or angiotensin 2, which is the most important thing in when it comes to the hypertension. Angiotensin 2 is a part of renin angiotensin aldosterone system, that is RAS. So this angiotensin 2 activates this aldosterone, and this aldosterone again causes sodium and water retention, and it increases the stiffness, reduces the compliance of the blood vessel, and that is responsible for the endothelial damage as well as the cardiac dysfunction. Now, by inhibiting this angiotensin receptor, this telmisartan causes its effect and it is one of the best medicine for hypertension. The thing is, this telmisartan is first drug of choice for hypertension. So if anyone has diabetes or hypertension, and if they have high blood pressure, I would always think of telmisartan as a first drug of choice because it is an excellent drug and it has so much advantages. Uh, the thing is, it is remarkably free of much side effect. So it is almost very easy to use, and it is remarkably free of any side effect. Whereas when we talk about clonidine, now clonidine is what? It is a central sympatholytic. So it directly acts at medulla where we have this vasomotor center. It is actually an alpha 2 agonist. So what it does, it directly acts in the brain. It reduces the sympathetic tone, it enhances the vagal tone, and it also reduces the plasma noradrenaline levels. So this actually acts in the center where we have the blood pressure control mechanism. That is the reason why it can cause a very marked fall in blood pressure, and as it enhances the vagal tone, it can cause very serious bradycardia. So it should not be given with beta blockers. So this effect, this sympathetic tone reduction, fall in blood pressure, reducing the NORAD levels, and enhancing vagal tone, these are extremely potent effect. That is the reason why this clonidine is never a first-line drug. It is mostly used in refractory hypertension or most of the time in CKD patients, because in CKD patients, telmisartan is usually not used. Beta blockers are used. This amlodipine or cilnidipine is used. Prazopress is used. In spite of using all the medicines, the CKD patients do have very high blood pressure. That time, we are usually left with only one option, that is this clonidine, because it actually works at medulla. It enhances the vagal tone, so it can definitely control the blood pressure in CKD patients where almost all the other drugs usually fail. So it is a potent antihypertensive. So CKD is one of the last resort to control the high blood pressure, especially only most of the time in CKD patients, or rarely in those patients who have refractory hypertension. Whereas telmisartan, it is one of the first drug that is used to control the blood pressure, and any patient, if he is diagnosed with hypertension, any young patient, elderly patient, middle-aged patient, if they're diagnosed with hypertension, we usually tend to start this telmisartan because it is remarkably free of side effect. So this telmisartan effect is enhanced by the diuretics, and the peak action of this telmisartan is over a period of 2 to 4 weeks, which is one of the beauty of this drug, so that the patient may have a good and prolonged and sustained blood pressure over a period of 2 to 4 weeks. As we know, this drug does not increase the kinin levels, so this cough, angioedema, urticaria, these side effects are not seen with telmisartan, which are very commonly seen with angiotensin converting enzyme inhibitor, that is captopril or lisinopril or ramipril. The one of the most beautiful thing about this telmisartan is the benefits of this drug. The benefits that it retards the diabetic nephropathy, it reduces the proteinuria, it reverses the left ventricular hypertrophy by inhibiting this renin, angiotensin, aldosterone system. It reverses the vascular hypertrophy, and this is how, by reversing the LVH, by reducing the proteinuria, by retarding this nephropathy. So it benefits the vessels hypertrophy, it benefits the heart, it benefits the kidney. This is how it improves the death rate because of the cardiac heart failure. So it improves the cardiac mortality. It reduces the hospitalization for heart failure in those patients who have hypertension, those patients who have heart failure, or those patients who are diabetic and with heart failure. That can be heart failure with preserved ejection fraction, or that can be heart failure with reduced ejection fraction. And but these benefits, these are not seen with clonidine. Clonidine actually simply acts in the medulla, in it enhances the vagal tone, so it does not help in reducing the diabetic nephropathy, it does not benefit in proteinuria, it does not reverse the LVH, and it has no cardiac mortality benefit, or it does not reduce the hospitalization because of the heart failure. In fact, the clonidine actually peaks over 2 to 4 hours, and the duration of action of this drug may last for around 6 to 24 hours. The most of the time, how we start is we give zero point 0.1 milligram of this clonidine, that we can start 3 times a day. Over a period of a day or two, if the blood pressure is not well controlled, we can increase it to zero point 0.2 milligram thrice a day, and maximally we can give this drug up to zero point 0.3 milligram 3 times a day, up to zero point 0.9 milligram. But we have to be very careful to avoid hypotension, and we must always look for bradycardia, because this clonidine can markedly increase the vagal tone, and it can cause significant bradycardia, especially if they are used with beta blockers like atenolol or metoprolol. This we definitely have to be very, very careful about. The other things is, uh, as we know that this is a potent anti-hypertensive activity, the chronic use of this drug can definitely reduce the cardiac output, and it can cause markedly fall in blood pressure. And one of the most important thing is this rebound phenomena. So if someone is getting this clonidine for suppose few days, and if this medicine is stopped suddenly, in spite of not reducing or not tapering, if this drug is stopped suddenly, the patient may have very high blood pressure, the patient may have palpitations, waiting, high blood pressure, uneasiness. So this is all rebound phenomena because of sudden withdrawal of clonidine. So sudden withdrawal of this clonidine is not at all permitted. The dosage can be reduced over a period of few days, and then it can be 100% stopped. The other side effect of this clonidine is the impotence. So this is because of this alpha 2 partial agonist activity, and this impotence can definitely one of the limiting side effect of this clonidine. I already spoke about bradycardia, and one of the most important thing is asymptomatic postural hypotension. As I told that it enhances the vagal tone and it reduces the sympathetic tone, the patient may have marked postural hypotension that we always need to worry about. These are the problems with the clonidine, which makes it not the first line drug for hypertension, but it is one of the most important drug. In fact, it is one of the most powerful drug that can be used in CKD or in refractory hypertension patients, that definitely gives us good blood pressure control where almost all the drugs fail. So clonidine is the drug that is used at last resort where all the drugs fail, whereas this telmisartan is the drug which has to be the first drug in almost all the patient where the patient is diagnosed with hypertension. Most of the time, the drug dosage of this telmisartan is 40 to 80 milligram once a day, and this as it is block this angiotensin receptors, it has a tendency of causing hyperkalemia. That is the reason why whenever creatinine rises more than 2 milligram per deciliter, it has to be used very, very, very carefully. Many of the nephrologists, physicians, they use this telmisartan up to creatinine value of 4, but we have to be very carefully, uh, be cautious to look for the potassium level because it can cause hyperkalemia, and this hyperkalemia can be life-threatening, and hyperkalemia can present with blocks, complete heart block or any block, and the patient may have VT, VFib, or cardiac asystole. So this was all about the wonderful drugs telmisartan versus clonidine, and thanks for watching.